Last week, Vytorin and Zetia were in the news with a study on how effectively they treat cholesterol. Now, everyone knows the names thanks to those headlines, as well as the massive advertising campaigns to market those drugs. Well, the Food and Drug Administration reviews about 400 drug names a year that companies submit as proposed brand names, and it rejects about a third of them. So for today's Brand X, we go behind the names of drugs with Bill Johnson. He is the president of Brand Institute, and Dr. Bill Trombetta, a pharmaceuticals marketing professor at St. Joseph's University. He joins us from Philadelphia. Okay, since you're both Bill, I'm going to use your last name so I don't confuse us. Let's start with you, Mr. Johnson. Tell me, where is it that these names come from? Because as I said in the early part of the show here, usually they're names that I can't even pronounce.
Names are created with a focus on communication to the patient as well as the physician. So in doing so, you try to identify some of the key benefits and imagery that can really support what makes the product different.
So, why is it that in certain cases some of them don't sound like the condition, or that they all tend to, I don't know, am I crazy, but they all tend to start with Z's or X's? Explain the philosophy behind that.
Sure. The majority of companies creating names for drugs and biotech products are looking to have a global brand. In other words, one that will translate across the entire world. And sometimes familiar English words don't necessarily translate. You also have to keep in mind legal availability and obstacles from a trademark perspective.
Dr. Trombetta, let me turn to you. Just explain to me for a second, what are some of the other factors that go into it? Because as we mentioned, the FDA will see as many as 400, and usually about a third of them get tossed out. So talk about some of those other factors and metrics when a drug company is releasing a drug.
Well, back to some of the alphabet considerations, there are certain letters that connote different things. For example, Z, S connotates speed, P, M, D, T connotates power. So there's an attempt to take use of those kinds of linguistic angles. The other thing that's important is you want to communicate the function that a drug does as well as the emotional attachment to it. And you're concerned about memorability. It's worth its weight in gold. And you're also trying to stress safety and also reduce confusion in the marketplace.
All right, so Dr. Trombetta, if you don't mind, give me an example of one of those cases. What's a specific drug that does all of those things?
Well, going back to the Z's and X's, that way may have been the way it was done a few years ago. How many Z's and X's can I get in a brand name? And I guess by that standard, Zithromax is a great brand name because it has a Z and an X in it. But some other examples would be things like Ambien. It's a sleep drug, so AM and Bien, very good. I guess it's very good to wake up in the morning, especially if you get a good night's sleep. Boniva is another combination where it's for osteoporosis or bone issues. So the letters bone and viva combining together, a good life. So those are some of the considerations, and those are memorable names, and they seem to connote what the drug has to do with.
Wow, I hadn't even thought about it in some of those names, what you suggested. I just learned something. Let me turn to you, Mr. Johnson, because the Brand Institute has worked with many of these drug companies to create some of these names. Tell us some of the ones that you participated with and how they've been successful.
Sure. I mean, we could take some high-profile ones like a Lunesta, a sleep aid. The whole focus is to focus on imagery associated with sleep and a good night's sleep. So in that case, words like lunar or siesta. A recent example would be the HPV vaccine for young women, Gardasil. It's about guarding or protecting against a virus.
Okay, so Mr. Johnson, explain this to me. One drug, okay, how many different names do you sit down and think about for that drug, and how long does that process take? I mean, do they send it to the FDA for trials while you're creating the name, or do you create the name first? How does that work?
The majority of work is done in advance of sharing it with the FDA. And in some cases, we could create as many as hundreds or thousands that go through our different processes for trademark clearance and market testing with physicians and patients. When the FDA gets the name, they're typically reviewing one at a time, And with that, there's a lot of support that's been prepared by the manufacturer.
You know, Dr. Trombetta, you know, they've given me a couple of examples, and I'm going to butcher these names, of course, that they sound like alphabet soup. I mean, they're so hard to say. But Xyzal and Ketec, I mean, what are these drugs for?
You got me on those. I've never heard of those two drugs.
Oh, good. I see. Like, there you
I hope
go.
I learned something today.
I mean, it looks like Xyzal. That's an indoor-outdoor. If we can bring the screen back up, we'll show you those. That's an indoor-outdoor allergies. And Ketec is community-acquired pneumonia. Wow, this is unbelievable. All right. You know, Dr. Trombetta, how significant is brand recognition when you select these names?
I think it's very significant because, remember, there are so many brand names out there, it can be confusing. And also, when we tend to think of brands, whether we're doctors or pharmacists or patients, we only have a limited space to consider. We don't want to consider 100 brand names. So what we call top-of-mind recognition, the 2 or 3 brands that readily come to mind, is extremely important in making decisions and prescribing.
All right. I have some names for the 2 of you. I'll start with you, Mr. Johnson. Okay, this one, take a look here. This is Bernenkinson. Gee, guess what that is? Then we have Wofalax, and we have Gold Orphan. What do you like it? Gold Orphan. I don't know. You think those are possible?
Those might be challenges. They're a little bit long. Keep in mind we're shooting for easy to say, spell, remember, but they certainly are memorable.
Well, you know, so normally do you try just to keep it to like 6 letters?
Well, in some cases, the number of syllables is important. So 2, 3 syllables, easy to remember, just as Bill said before. Wow.
All right, Dr. Trombetta, you have any great ones up your sleeves that you want to share with us?
Any great what, brand names?
Yeah.
I think that some of the ones that were just mentioned are classic names. There's one out there that comes up for... let me see. I think some of the classic names like Lunesta and those that connotate what the drug does, it has to do with sleep, getting a good night's sleep. So those are some classics.
All right. Well, we'll leave it there. Dr. Trombetta, thank you so much for joining us. And Mr. Johnson, thank you as well. We all learned something very interesting today. All right. Coming up.